right. Hi, and welcome to the Empower Nutrition Podcast. Dr. Brannon, we're so happy to have you. Thank you for coming.
Thank you, Ms. Erin. I appreciate it.
Oh yeah, this topic is so important, and I think there's so much mystery to it, and kind of misinformation, and a lot of kind of questions that people have. So I appreciate you lending your expertise to us.
I'll do the best I can. Thank you.
Yeah, well, maybe just to start out, I know that obviously you have a long experience in OB/GYN practice, and then it sounds like in 2020 you transitioned to your current world of bioidentical hormone therapy. So maybe you could tell us a little bit about that decision of like why get into, we'll call it BHRT for short.
Yes, I was an OB/GYN, which I loved for over 25 years, almost 30 years, enjoyed it. But during my contact with these lovely women, seeing some of their normal cycles, such as menopause, perimenopause, in the 20s, having these complaints that were like feeling tired or brain fog. To me, it just can't be covered up with antidepressants. There had to be something going on. So I started a lot of time studying nutrition, spent a lot of time on root causes. I actually started Optimal Bio in 2012. It was called Carry BHRT. And I spent 2 years studying how can I replace hormones that are bioidentical with the least side effects. And I found out about pellets. Pellets are dried pure hormone that have been used in women since 1935, men since 1937. And the big thing is this: when I ask women or men, what's the most abundant hormone in the human body? A woman usually will say estrogen. A man will start by say insulin or cortisol. It's testosterone. In fact, testosterone is 50 times higher in women than estrogen.
Yeah.
It's not a male hormone. It's a human hormone that every single cell in the body needs to run efficiently. But here's the problem. I'm 63. When I was in school, the range for a woman was roughly between 70 and say 200, 250. Today, a range is between 3 and 41, significantly dropped. Men, the range is roughly 800 to 1400. Some institutions call normal under 170 now for men. This dramatic drop has been parallel, probably approximately 1% to 2% decrease per year since 1970. So we went back and started studying, well, how is testosterone formed? How does our body work? The neuroendocrine system, right? So the hypothalamus talks to the anterior pituitary. FSH in women makes estradiol, but that comes from testosterone. In men, LH makes testosterone and converts to estradiol. It's estradiol that's the rate limiter. That's what goes back to the brain to turn this off. In the last 50, 60 years, we've been bombarded in our environment with xenoestrogens, fake estrogens, plastics, Roundup, atrazine, pesticides, dyes, shampoos, paraffins. All these things are mimicking estrogen, so your body's making less testosterone. And the sequelae of that is hyperinsulinemia, belly fat, depression, decreased libido, all these things that are occurring. I think it's important we attack at the root cause.
Well, yeah, I mean, I guess that's kind of an important thing to ask about. And this is because I agree with you, the root cause is xenoestrogens and maybe a little bit of stress and sleep deprivation to go with that, nutritional deficiencies. So I think that's a common argument around HRT is like that if we give hormone, that's not addressing maybe the root cause. The root cause is maybe getting these xenoestrogens out of our, exposure, like reducing our exposures to them and like eating the right diet.
The root cause, though, is the lack of the hormones, right? The lack of the hormones. So in the womb is when the gonads are set to how much estrogen, testosterone they're going to make when they mature. So these microplastics cannot be filtered through the placenta. So babies are being bombarded in the womb. So we'll make a number up. Say my generation, an average boy, when he starts hitting 18, 19, he's around 12, 1300. Today, an average boy is around 12, about 300, 400. That's significantly different. So the root cause, yes, it is the environmental, but I can't make the organs themselves make more, but I can replace it. So your body thinks it's making that. I call it the pre-plastic era, the pre-xenoestrogen era. What were the labs then? And that's what I try to get my body to. Because again, the body, if it's bioidentical, that means atom for atom, molecule for molecule, three-dimensional. If it has it, it knows how to utilize it, metabolize it, eliminate it. It's not a foreign substance. And therefore, the body can run at its optimal level. So again, the environment, I want get clean water, eat organic, have the right stuff. Look at our topsoil has been destroyed. Talk about nutrients, iodine, selenium, all this stuff is out of our topsoil. So in ideal world, with the animals we eat, the vegetables we eat would have that in there. It's significantly decreased. So, but the problem is we can't make our ovary, adrenal gland, or testicle make more. We just can't. They're set in the womb. So therefore, our body's working at 20-30% efficiency.
Okay. So good point then. So what you're saying is basically like, sure, yes, you should optimize your environment, but because this is impacting even from like fetal development, the baseline level that people are going to achieve in a perfect environment is still too low.
Exactly, because I agree. There's 5 things I believe to do age gracefully. Sleep. Number 1, eat properly. 3, exercise. 4, remove stress. 5th, restore what you've lost. But I believe it's a catch-22. I think number 5 is number 1, because then you could sleep, then you could eat, then you could exercise and remove stress. When everything's out of whack is when your cortisol goes through the roof. When you're sleeping, your cortisol comes back down. I like to say is nothing's in isolation. It's to say one thing fits all. No, but I know one thing, the fuel on this, like we would never say it's okay to live with no insulin. We'd never say it's okay to live with no cortisol. We would never say that because there's a disease process that's pretty acute. The problem with low testosterone is a daily loss, a daily death. It's not a bomb you get hammered off day one. That's the problem. So the most abundant hormone, we never say, oh, for your age, having this amount of insulin is fine. We'd never say that. What's optimal? The blood sugar being under 90. That's optimal. So that's why it's important to understand why we're low. We're not because it's an evolutionary adaptation or improving. It's just the opposite. It's the environment bombarded on these things. The xenoestrogens are powerful.
Yeah, and it sounds like I align with you in the sense of what I'm not hearing you say is that, oh, all you just need to do is take pellets. It doesn't matter what your lifestyle is like. It doesn't matter what you
far
eat.
From it. It's just it's a key component. I believe it's a cornerstone of overall health. So I give a ton of numbers. A man whose testosterone is under 540 has an 88% higher chance of a heart attack. A man whose testosterone is under 300 actually has 250% higher time of overall mortality. Diabetes is decreased by 200%. So when numbers are optimized, the system we have, our body, both male and female, can operate at the most optimal rate. That's the key. Is again, I'm not against aging. Let's age gracefully. But we're tolerating a 20-year-old today normal if they have an 80-year-old hormones from 50 years ago. No, that can't be normal. And because something's common doesn't make it normal. If we're all diabetic, we call diabetes normal now? Of course not. If you were checking what the most optimal blood sugar is for your health, and you have 1 million people in this study, but they're all diabetic, your results are irrelevant because they're all diabetic. Right. I need a placebo group of non-diabetics. The problem is in our environment, we don't have placebo groups. I'm going back 30, 50, 60 years of data to get levels when these things were not around.
Yeah. Yeah, it's like that. I mean, it's like a frog in slowly heating water or whatever. I mean, I was just at the IHS, the big functional medicine conference last week in New York, and there's a great peds talk about how like children now, their generation is the first generation in America that's predicted to have a shorter lifespan than their parents. And it's because of like the epidemic of childhood obesity, childhood diabetes, child mental health conditions. It's like, where is this coming from? Where you can become diabetic, before you're in
it's the food pyramid. The food pyramid killed us. 1977, going from a high fat, high protein diet to a high carbohydrate, low fat diet destroyed us. When I was in training, PCOS, small pet people, metabolic, small amount of people. Now it's
fair.
Fatty liver. The first case of non-alcoholic fatty liver was 1980.
Yeah.
The first case.
Yeah.
3 years after the food pyramid. Now it's 40 to 70% of Americans have abnormal LFTs, which can go away in 6 weeks of getting rid of your sugar.
Yeah. I mean, of course I'm biased, but of course I think diet is the major player in it. But I also think that the xenoestrogen picture, the environmental exposures are a piece of it as well.
Yep. Yeah. But sugar is such a inflammatory nidus, right? Mm-hmm. The number one anti-inflammatory our body makes is testosterone. So the thing is the free radicals, right? The extra electron, that's the killer, right? And sugar increases that. So if you could have a diet that's high in fat, high in protein, a proper amount of complex carbohydrates. I'm a real big believer in intermittent fasting. I really like the balance between mTOR and AMPK. When that's balanced properly, then you're metabolically healthy. The weight is the worst thing to look at. It's metabolic health. And that's why it's so important that, again, I use an example I use in my office is, let's say we're all Ferraris. You need two things to run a car, not an electric car, a combustion car. You need gasoline and a carburetor. The thyroid is the carburetor and the gasoline is the testosterone. When that's in optimal range, now you can wash it. Now you can wax it, put air in the tires, other things you got to do to run optimally. But you first need that foundational fuel. You need the oxygen for the mitochondria. You need the fuel to turn it all on.
Totally. Yeah, we teach the same thing. It's like, don't just try to, if your challenge is metabolic, weight, insulin resistance, don't just try to eat less food, because the issue is metabolic health. You fix your metabolic health, the weight will follow.
Bingo. If people get all stuck on weight, that I'm not sure how you feel about semaglutide, but you lose 3/4 muscle, 1/4 fat.
Yeah. Good luck keeping your weight off when
it's terrible. You're thinner, but you're fatter. So that's the idea is like, you're the nutrition expert, but most of us will usually eat 2 meals a day. We either lunch and dinner or ate breakfast and lunch. This whole idea of 3 meals a day, 3 snacks, all that stuff came out of nowhere, based out of Madison Avenue, and that destroyed us. We got to get back to the way we used to eat. And I think it's like you said, it's simple things done repetitively. It's not a magic pill. It's not a magic pellet. It's not a magic this or magic that. Those are little things on the side. But the optimal thing is, if we have to talk one time about anything, it's sleep. Sleep is your body's way to just reboot everything. And that's crucial. And exercise, walking and lifting heavy things a couple days a week. I'm not saying don't do CrossFit or do triathlons. I'm not saying that. I used to do those things. But it's simple things. We make it so complex, the average schmo like me we all confused. No, we don't be a professional athlete. We just got to walk, and we have to lift heavy things now and then and eat proper food.
Yeah, and especially, so many, and I'm sure so many people that we work with are like massively stressed out. They aren't getting enough sleep. They already have high cortisol. So when they do that kind of high intensity, again, I was a CrossFitter for a long time too. I'm not saying it's bad for everyone, but people in that kind of middle of life, like churn that's like very stressful, I don't find that type of exercise tends to help their hormones very much. But what do you think?
I was diabetic 20 years ago.
Were you?
And I was doing iron triathlons and CrossFit.
Yeah.
But I ate 3 meals a day, oatmeal every morning, brown rice, 3 snacks, and it was terrible.
Yeah. Booze and gels while you work out.
And so when I learned to eat, I lost 30 pounds in about 6 weeks. I got leaner, I got cutter, and I got stronger. When I learned what really food was supposed to do. So but I was an OBGYN. I was on call every night for 30 years. So but when I started doing pellets, I'm 50, I say 60, 50, I started doing pellets. My call didn't change. I was older. I'm in better shape at 63 than I was at, say, 35. I'm 8% body fat. I work out like I tell you. But the big thing for me is reading, my brain, words. I read about 4 books a week. I read a lot of articles every day. It's really keeping that brain going, because I don't think aging is a problem. I think aging is a blessing. It's my dream is the biochemistry of a 20-year-old with the wisdom of an 80-year-old. That's like my dream, right? And my new book comes out, Restore. It's the first hardback book, 85,000 words based upon hormones and pellets, and it comes out March 12th. But I tell a story about all this. The key is not, I don't want to be young again, because there are things I was foolish about, but I would like that chemistry again. And then the wisdom being older. I think that's how we age gracefully.
Absolutely. You want to be able to be vibrant and enjoy your life. Yeah. Tell me about, and this I know for you is very basic, but I think a lot of people don't understand the difference between bioidentical hormones and just hormones. So for a long time, tell me about that.
Yeah. Hormone in Greek means messenger. So it does a function. So what's interesting is your body makes these all day. The neuroendocrine system is how our body runs, right? But the secret is pharmacy companies cannot own an organic molecule. If it's found in nature, they can't own it. They can't patent it. There's no money to be made. So for me, I think the onus is on the pharmacy company to say, why is their testosterone, which is unrecognizable to the body, superior to the one your body makes? Or in women, estrogen, versus Premarin, Provera versus progesterone. There is a difference. And when you look at the structure of the molecule, it's different. And the structure of the molecule causes different metabolism, different metabolites, different eliminations. So the definition of bioidentical, according to the Mayo Clinic, is body recognizes as same. That means the strength is the same, the metabolism is the same, the elimination is the same. In the testosterone realm of it, you have three groups of synthetic testosterone: the ester, the cyprinate, the most common, 19-nortestosterone, 17-alkylation, which we take orally. They all work, but that's where you have side effects of blood pressure and blood clots. The big thing, there's a good book out of Belgium talks about this. All three of those increase neuronal apoptosis, so brain cells die off sooner. They're shown over time you have increased Alzheimer's disease. The one your body makes lowers blood pressure, no blood clots, and makes more brain. I use it a lot with our military, with our TBI patients and PTSD. About 80% of our patients are antidepressants are often 4 months because it makes more brain, called neuroplasticity, and makes the synapse actually tighter, so-called synplasticity. And that's all done by testosterone.
Wow. Okay. And then I guess, yeah, this leads into another question that obviously we have to talk about, and I'm sure you have a perfect answer to this, but
cancer.
Yeah, exactly. So, you know exactly where I was going with this. I like the work of Dr. Peter Attia, and he talks a lot about how basically like a lot of the original HRT research was kind of flawed because it was looking at women who had fully gone through menopause and then started HRT, and it wasn't bioidentical HRT and like all these factors. But I think there's still a lot of concern around, does HRT cause cancer? And like, are there certain...
I'll go over all that.
Yeah, go ahead.
The first time doctors isolated testosterone was 1931. The first study of replacement of that therapy was in 1935. It was pellets, the deep dried hormone. It was in women, okay, who had hysterectomies. 1937 was the first paper on men. Now, estrogen was isolated the first time in 1940. So that came out. From 1935 to 2002, the famous WHI paper, there was virtually no papers that said increase in breast cancer. But that famous WHI paper came out.
Yeah.
I called up the most famous OB-GYN in the world up when that paper came out, Dr. Michelle. He trained me at USC. And we had a long talk. He goes, Greg, that paper's terrible. Here's the data. They used Premarin, which is 212 horse estrogens by itself. By the way, the Premarin arm did not increase breast cancer, but it increased blood clots, okay, because you take it orally, go in the liver. The Premarin arm with Provera increased breast cancer 24%, but it skewed an older population. Now, a guy named Fiornero in France did a study in 2005, 2007 with 134,000 women. He gave them estrogen, bioidentical, progesterone, bioidentical. That arm decreased breast cancer 10%. The arm of estrogen, bioidentical with Provera, medroxyprogesterone, increased it 69%. Dr. Glazier's work out in Ohio, she's a cancer surgeon, breast surgeon, by giving testosterone pellets in her studies, it decreases breast cancer between 40 and 60%. So here's the nerdy part. Estrogen, there's three estrogens in the body, E1, E2, E3. E3 is by the placenta, so put that away. There are two receptors, an alpha and a beta. Consider alpha potentially more growth and a beta is negative growth. The E1, which dominates in menopause, is 5-to-1 alpha. E2, which dominates in young women and in men, is 1-to-1. It's neutral. And E2 beta actually decreases its own receptor, its own production, and testosterone suppresses all of that. And the really interesting thing, estradiol alpha increases a thing called BCL-2, which cancer cells love. Estradiol beta decreases BCL2-. Therefore, it's important to understand which estrogen, which part of your age. But the study was interesting too. Hopkins went back and looked at WHI's paper 15 years later. They found women on the synthetics who had cancer were living longer because they had less dementia and heart disease. All right. So my goal was to get the benefits without the risks. And that's the issue. A molecule that our body makes can't, by definition, hurt us, or the species would not be here.
Yeah, that's a good point. And then, like, what do you do in terms of monitoring? So, like, I mean, I don't know if you're a believer in like tests where it looks at like, okay, here's how you're metabolizing estrogen. How much do you have the
Oh, I sure
16-OH, the
do.
4-OH, the 2-OH? Tell me what you think about all that.
I sure do. Yeah. So T becomes E by aromatase. So testosterone becomes estradiol, androsterone becomes estrone.
Mhm,
There's three pathways you talked about: 2, 16, and 4.
mhm.
2 is the good one because it's neutral. It's no
Yeah.
alpha. 16 and 4 are actually are alpha receptor metabolites. Birth control pills goes down 16. Premarin goes down 4, which actually also increases DNA fragmentation. So the when you check your metabolites in the gut, that's fine. That tells you where you're at. But the key is, I believe in giving DIM, indole 3, because what that does, that pushes the estrogen pathway through 2, so you have decreased alpha production. Very important for breast and also for men. Prostate cells and breast cells are glandular cells, almost identical. They have a thing called the sodium iodine system where you pump sodium, 2 molecules of sodium out for 1 iodine in. That keeps the structure of the gland in place. Testosterone, high testosterone in young men, suppresses aromatase in the prostate, which suppresses estradiol alpha, which decreases prostate cancer. That's why 8-year-old boys don't have prostate cancer. When the testosterone drops, increased aromatase increases prostate cancer. The famous paper in 1941 that says testosterone therapy causes prostate cancer to grow by Huggins and Hodges actually had a study of one man in the study who was castrated. Dr. Morgenthau from Harvard has destroyed that with his literature on that. That's fallacy.
Yeah.
So the whole idea of the metabolites are crucial. So your body wants to go down 2 pathway. The problem, I believe, with fibroids, endometriosis, prostate cancer, is the xenoestrogens. Almost all of those stimulate alpha receptors. I believe that's the component. When women are called estrogen dominant, I don't think it's them personally making more estrogen. I think it's the environment. Now, there are women who are estrogen dominant naturally. That's if you don't release LH to make progesterone, you will be estrogen dominant. But if you're having a period, by strict definition, you can't be estrogen dominant. So if you are, it's outside agencies, and that's where DIM comes great to get rid of that, get rid of the xenoestrogens.
Okay, so you would do like, I mean, I guess obviously it depends on the situation, but like if you're giving an estrogen pellet, you would also give DIM.
Yes, there are some cases I'll give anasosol when I give a testosterone pellet in the pellet, so that I want to keep estrogen in optimal range. It appears in men to be roughly around 30. Women, I don't give estrogen when they're young because they're making their own estrogen.
Right.
In a menopausal woman, my goal is to get them to like be a 20-year-old from the 1940s. That's the goal I'm looking at. So basically the luteal phase. So I want to keep the progesterone around 3. Keep the menopause is by definition FSH above 23. So I give just enough estrogen with testosterone, balance it to keep the estrogen around 20. So then you make bone, no vaginal dryness, the bladder not falling down, osteoporosis. And women lose 5% of bone in menopause, 5% every year.
Yeah, I know.
The pellet increases bone formation 8.3% per year.
Wow.
So an 80-year-old woman can have more bone than 40 if on pellets.
Yeah.
And you talk about cancer. Women, the number 1 cause of death for women is heart attack, right? 1 in 2 to have heart attack. Breast cancer is 1 in 7 times 0.03. It's, don't get me wrong, cancer is not what I want, but cancer is increasing in America. In Japan, it's still 1 in 20. They have a higher iodine. They have virtually no thyroid disease. These kind of things protect the tissue. So again, I think it's environmental, and they turn on some oncogenes. But the bottom line is this: this body is amazingly made if given the right substances, the macromolecule, all these things to make it run efficiently.
Yeah. Well, it sounds like there's certain phases of life where BHRT is more needed, but like, what would you say what would you say would be like your wish that everybody would like get screened at least?
Our average
age
age person is between 37 and 42. Is that crazy?
that they
Yeah,
get
I thought you'd be
screened?
much older than that.
Mm-hmm.
Here's the thing. People come to me. This is the reason they come. Tired of being tired, brain fog, anxiety, mood, belly fat, libido, basically in that order. But it's virtually always brain fog and tired of being tired. I go back to the fuels. That's why I look at the thyroid, all the numbers. I check 9 parameters of the thyroid, and I look at testosterone levels. Because this is, if you're 25 years of age, your testosterone will say is 40, it's low, but you feel great, don't do it. Don't do it. At the same time, a woman in their late 30s, early 40s, that's you start protecting your brain from dementia. A woman is 3 times higher for dementia because your hormones go boom and stop. That's what's important. The goal is don't wait for osteoporosis. Don't wait for dementia. Let's attack aging the disease and keep our levels youthful. I know I'm redundant, but we never say it's okay to battle insulin at your age. We never say that. The same thing with these hormones.
Kind of what I'm getting at is like, I suspect the whole thing lags in the way that insulin resistance lags. It's like, if you wait till you have type 2 diabetes, you're at least 10 years into this when you've been accumulating health problems related to insulin resistance for at least a decade. So I'm sure it's the same with hormones. It's like, you don't want to wait until your symptoms are extreme. But
I agree. And that's the thing, Erin. This is the problem is, if you came to Dr. Brannon 20 years ago and I drew your levels and I got your level, and I was never trained to even draw a woman's level for testosterone, but a man, and you fall within that bell curve, I mistakenly say, oh, you're healthy. But Greg, I feel garbage, but you're healthy, you're in range. That's what got me looking backwards. How can somebody, because here's the bottom line. You know your body better than anybody will ever know your body. And if you know something's off, the doctor's got to listen. The nutrition's got to listen. We got to listen. And what I'm finding, we have over a 98% retention rate. So we're putting people, and nobody's forced to come to us. When I get their levels in optimal ranges, they're telling me I sleep better. I wake up better. I got words again. My memory's back. I'm working out again. My intimacy's back. I mean, we hear that every single day. I've probably placed 40 to 50,000 of these in the last 12 years. And it's very, I don't know. It's just like a big pat on the back. Like, we were doing something makes a difference. And it's just not a pill to walk out. But you said, 20 minutes ago, if people want to pellet and feel great, no, you still got to eat, sleep, and do things properly. I'm a big believer in, you know how many classes in nutrition I took in med school? Zero. When I became diabetic, I had to learn. So I got board certified in functional medicine as well. I got 2 fellowships in it. So I had to learn. Education, got to keep on learning, right? Got to keep on learning.
Yeah. I mean, it's rewarding when you can actually when you actually get that feedback from your patients, that they actually feel healthier, they're doing better, their life has changed. They're not just coming in to get.
Yeah. And we're 8 offices in 4 states. So it's not like just one of our offices. It's across the board. And like, we're never the first doctor. It's like, I've been with 10 doctors, my doctor says, everything's normal. Here's your Zoloft. And you're like, but I'm not depressed. I just feel bad. And that's the issue. And that's why it's so important to understand how everything works. Nothing's in isolation. And then we put everything in optimal ranges. Like use thyroid as an example too. Or back to your diabetes. A type 1 diabetic and a type 2 diabetic are 2 different ball games. Yeah, we treat them the same. Jason's Fung books is insane on this stuff.
Yeah, it's so good.
It's just great. I mean,
yeah,
so you make insulin, it's not working properly. So we give you more insulin. There's something going on. How about less sugar? We don't think this thing through. And a lot of it's just common sense. And again, if I listen to you, listen to the patient, listen to my own body, I'll get more out of it than put you in a grid and say, well, you're 35 years old, you belong here. No, that's not the way it works.
Yeah. Well, it sounds like, based off what you said at the beginning, that people just have a lower ability to produce at their levels that they need. It sounds like there wouldn't be like a goal of like weaning from BHRT. It would be more just, I suppose there's some like monitoring over time.
Right. I check, I get blood, the gold standard. I get blood levels. If I do cortisol, I do saliva because you need a curve and it's more accurate.
Yeah.
But for my testosterone temperature, I do blood. I find gold standards and we use in that range. But it's the way our DNA produces the androgen receptor is very individualized, how the messenger RNA reads it. So that's why I make a number up. Say I feel great at 1,000, but another patient feels great at 1,200. I use the subjective feelings on what your range should be, because we really are treating how you feel. And we know certain numbers protect the heart, the brain. The big thing, I'll give you an example. LabCorp, June 30th of 2017 for men, the range was 348 to 1197. On July 1st, the very next day, they dropped it to 264 to 916. The next day. But the new study they had more obese people in it, had younger people in it who are being bombarded in the womb. That's why we got to look at this idea of treating symptoms and treating individuals, not just numbers. But I really believe that, you're pro the xenoestrogens is, yes, I believe in Berkey water filter. I believe in filtered water. I believe in free range. I love all that stuff. I believe in fasting, deadlifts. All these things help testosterone. Fasting increases testosterone. But you can only go to a certain level because you've been bombarded. So get out, do everything you can do. But to get the optimal range, I believe especially as you age, it's like there's no replacing this. There's nothing better for your brain and body for this.
Is there an age where you would say people kind of like missed it? I would say, especially with women, what I'm getting at is like, okay,
The original
you've been
paper,
in menopause and you missed
yeah,
it, or no?
no, if you start after 65, there's a slight increase in heart attacks, because it dislodges the plaque. But after 6 months, heart attack goes down. Everything goes down. Everything improves. Everything improves. So the answer is no. And you think about it, 65-year-old, they're going to live to 85 or 90. You live a 30 of your life feeling miserable, breaking bones. These things could be avoided. And so the answer is no, there's not. The complications are, if you've had breast cancer, you can't have estrogen for 5 years. You can have testosterone. If you have uterine cancer, wait 2 years. Prostate cancer, 1 year. Other than that, there really is no contraindication because it doesn't go orally, so you bypass the liver. There's no clotting issues. And if it sits in the fat of the skin, so it just releases steadily like an endocrine gland does. Mm. So it's just hard. I was the biggest skeptic. When I heard first about it, it took me 2 years of study. And I looked at the data, I finally did it. And I was like, what was I waiting for? And my wife and I have been on for 12 years.
Yeah. And then maybe tell me about this, because you obviously have a bunch of locations, you've got a bunch of practitioners. I saw something on your website about maybe an algorithm-driven protocol.
Algorithm has been used by another doctor, Tutor, who actually invented this stuff 40, 50 years. We fine-tuned it by the patient base I have. I added certain different parameters to it. So I can get our dose within 95% what you need for yourself. So that's why it's all individualized. 20-year-old woman on birth control pills, a different number than an 85-year-old woman not, or a man on this. It's very important to have an algorithm. We have probably 1 million people in the data now. So this has that range where it has to go.
Yeah. Okay. So it's like the practitioner is using the algorithm to determine the dosing.
And plus there's an art to it too. We hear things like most of the symptoms, we'll call we'll say you have breast tenderness for women or mood swings. It's not the testosterone. It's the estrogen metabolites. That's why iodine is crucial. That's why DIM is crucial, because it keeps, if you look at the synthetic testosterone, they do this up and down. Their half-lives are very short. When the T is going up and down, the aromatase is never in sync with it. So therefore the estrogen metabolites are out of sync. That's the problem. So a steady state that the pellet does, the aromatase is steady, your estrogens are steady, so you can pee out number 2 in the proper way. And that's how you protect the side effects.
Yeah, amazing. Well, this is so inspiring, and your knowledge is obviously so deep on this topic that it's just obviously a wonderful resource. So maybe you can tell people a little bit about, first of all, where they can connect with your clinics, and then also, of course, not everybody is in this area. We're in North Carolina, so you're here with us. But for people that aren't in one of your locations, or even if they are, can you also tell a little bit more about your book?
Yeah, it's optimalbio.com. It's our social media stuff. We have a YouTube channel. We do shows on that. We have podcasts like we're doing here. We try to get local experts in all different. I've had Dr. Brownstein on it. We've had Sean Baker on. We try to get all different people involved in like nutrition, all that kind of stuff. So optimalbio.com. My book right now is called The Hormone Handbook. It's about 120 pages. Good review of what we talked about today. The big one I'm very proud of is Restore. It comes out March 12th. It goes through, again, a story of a woman from womb to she gets older. Same thing with a man, how hormones work. But we have everything on social media. Our office is in Virginia, 4 in North Carolina, 2 in South Carolina, 1 in Austin, Texas. We'll be going across the country. We go about 2 or 3 a year. But I have people that fly into us around the country. I've been doing this. I've been very fortunate with our reputation. So we do a lot of Zooms. We do Zooms for years. And they fly to one of our offices. What I really want, if you use one word to describe Optimal Bio, it's education. I'm not here to sell pellets. I believe the king and queen is in the mirror. I want you to in charge. Liberty demands responsibility. I encourage people. You don't have to be an expert, but you got to get wise counsel and ask questions. And if your questions aren't answered, you leave, period. You're in charge. And that's how we do it at Optimal Bio. We have one consult fee for your whole life. We charge $250 for your whole life. We'll never charge to talk to us ever again because we want to walk with you. Things change. You read a paper. You went to your doctor. You Google this. You Google that. We give out videos. We give out, like I give a ton of Jason Fung stuff out. I give a ton of literature out. I want people to understand that they have the power for themselves to make these decisions if given the right knowledge. That's all I want. I give a ton of literature on cholesterol, how beneficial it is for the body. I just want people educated.
Yes, exactly. I think that's the critical thing in our time is creating a healthcare environment where people actually are heard and seen and treated like humans, because it's just clearly lacking.
We are great in America.
Yeah.
If I need a liver, I did a lot of high-risk obstetrics. Something goes wrong, we have great stuff.
Yeah.
But preventive health, nutrition, sleep, we're the worst.
Disaster.
We're the worst. And that's why I think we can find this. I think this balancing of allopathic medicine with holistic, nutritional, outside the box stuff. The way America was before the Fletcher Report of 1909, that took us down this whole bad path. But there's so many things out there we can do, as Plato talked about, food is medicine. There are things we can do to avoid seeing a doctor. That's my dream. That's the ultimate goal. Is you see me far and few between. I'm the gas guy. Put gas in your car, you go live life. But Miss Erin, my passion is liberty and freedom. And I think knowledge is truly powerful. And I want people to understand it's with the grass. I'm the kind of guy, I want you Googling. I want you rumbling. I want you to do all that stuff. Because if you think I learned everything in 4 years of medical school and I know everything, no way. Zero. It's a collaborative event.
Same. But at the same time, I think people are Googling and they are going on social media and they're more confused than ever because there's so many different people saying different things, and it's very confusing. So it's really great that you're not only a platform where you put out information, you also provide a trusted place where people can come and work with a practitioner, because I find that, for at least in my practice, people are looking for a source of truth, because going online doesn't make them feel like they can find that very easily. There's just 1,000 different opinions that often conflict.
I agree. I love that. I love the one-on-one come and talk stuff. But I'm talking about the Google part, as I don't want them to be like, don't go read. That drives me nuts. Don't go. No. Right. What am I afraid of? Like, as a surgeon, if I thought you needed surgery, I always ask for a second opinion. Always. Or if I was a second opinion, because these are big decisions. And you got to get as much, then you got to make the decision yourself. But education, knowledge, everything we talk about, this is powerful. And I think you have to, I hope people want to, I think this last 3 years in general has woken people up that they got to take stock of their own health.
Yeah, you can't just say, oh, I outsource my healthcare decisions to my primary care, because they do not have the ball for you. It's absolutely true.
Miss Erin, I can't say it better. That's great.
Yeah. Well, you are great. This has been so good. I really learned from you. And I'm sure that our listeners will be really excited to learn from your book and check out your practices. I'm going to definitely stop into our practice here in Southern Pines and say hi and kind of just check it out, because I'm very inspired. So thank you.
My honor. Thank you very much, Ms. Erin.
All right, great. Well, have a great rest of your day, and we'll talk to you later.
Thank you.
Bye.
Bye.